Hello and welcome. We're starting in India, where the healthcare system is collapsing under the pressure of a surging second coronavirus wave, with hospitals full, patients left untreated for hours, and supplies of oxygen desperately inadequate. It now has more daily cases than anywhere else since the pandemic began, and it's set a global record for 2 days running. We should receive the country's new daily figures shortly. In the previous 24 hours, it saw 330,000 new cases. Our Delhi correspondent Yogita Limai got access to the emergency ward of one hospital, and her report contains distressing scenes from the start.
The front line, an emergency room in a COVID hospital, just about standing under the weight of an unfolding disaster. A patient who's hardly breathing is brought in. As nurses try to get him to respond, there's another person, even more critical. Manjusha Matthew rushes to help. So many like her are putting in all they can. They couldn't revive him. To get past the shortage of beds, they've packed in stretchers, wheelchairs, as many as they can. But the first line of treatment against COVID-19 is oxygen. And they've almost run out. At this point, there is just 1 hour of supply left. The staff knows how many lives hang in the balance. People are being turned away, but they don't know where they'll find oxygen or a bed. Manora Bibi was taken in for a short while to stabilize her. We've already been to 5 hospitals. Where will poor people like us go? Her nephew asks. But this hospital is so on the brink, they have to leave. The intensive care unit is full too. There are next to no ICU beds in a city of 20 million.
These are patients in a critical condition. It's unthinkable, unimaginable that one would think of them as better off in any way. But it's the reality of what we're seeing in India. People in an ICU have won the first battle to be here.
Between seeing his patients, the doctor constantly on calls.
Back up, that's another couple of hours. So we are struggling.
He's desperately trying to get more oxygen.
We are running out of oxygen. The whole country is running out of oxygen, okay? The city is, we are, everybody is, okay? So please focus on that, please. You're doing a fantastic job otherwise, okay? Please. Okay, all of you remember that. If oxygen runs out, there is no leeway for many patients. There is no leeway. They will die.
Day after day, the staff works here, knowing full well that if their families get sick, even they will struggle to find medical care. There is helplessness and anger.
The government, in some ways, failed in estimating what was going to happen, the needs that would arise if the numbers started rising. There was a sense of preparation in the earlier surge, which seemed to have disappeared in between. And they did things which was totally unacceptable, allowing large, huge gatherings, which is totally unacceptable. They believed that we had vanquished the virus.
Some oxygen arrives a bit later, but it can only last a few hours. Then the struggle begins again. Yogita Limai, BBC News, Delhi.
India's front line there. Well, we can get more now from Dr. Uttal Gogia, a consultant at the Sir Gangaram Hospital in Delhi. Doctor, thank you so much for taking the time to join us.
Thank you. Good morning.
How has the situation in your hospital developed over the past 24 hours?
Well, it is really, really huge, the problem. We are totally packed. The hospitals are full and overloaded with patients, and we are already run out of beds. Oxygen supply is patchy. It's on hourly basis. Every day we have to run in for oxygen. from the authorities. So it is a difficult scenario.
The government is moving oxygen across the country by air and rail. Is that making a difference at the moment?
The only thing is that there is uncertainty as to the supply chain. The government has started mobilizing the oxygens, but still, as of now, the supply is limited. We have to have a continuous supply for us to be confident of managing such patients who are requiring high oxygen.
Without that continuous supply, you're being put in a difficult circumstance. How are you going about making those tricky decisions inside your hospital?
Well, it's really, really difficult right now because most of the patients are on oxygen who are in the hospital. Most of the patients who are mild or do not require oxygen are at home. So the supply of oxygen is not matching the demand. So we have to curtail and see that we are able to judiciously use whatever oxygen we have right now with us and are running around and ensuring from the authorities that we get a continuous supply so that we can salvage all the patients who are coming in.
And it's a tricky environment to work in. We understand the hospital phone lines are jammed and you find it difficult to discharge patients at the moment.
Yeah, there is a huge rush. Nobody expected the kind of rush we have right now. And the phone lines definitely get jammed because there's so many calls coming in for beds from relatives, from acquaintances, from patients for beds. And the problem is that we are not able to cater to the kind of demand which is there. So it is a very, very tricky situation right now.
Is there any cause of optimism, if that's the right word, from health professionals because of the attention that the situation is now getting? And do you have a message to the international community who are pledging to help?
Well, right now, we all need to understand the ground reality. People still do not have understood the ground reality. The problem is huge and unprecedented. None of us probably had expected this kind of a surge, which we are seeing. We all have to join in hands. It's not the government, but we as a people have to join in hands, ensure that we have adequate oxygen beds, regular supply. We need manpower. We need support system, which is very, very essential. We need your support as healthcare workers. We need emotional, physical, all kind of support right now because the healthcare workers are also started falling ill. We are working with limited people. There are stress in all. So we would request all to be patient, be cooperative, and help each other to tide over this severe crisis.
Gogia, thank you so much for joining us.
Thank you so much.
Some breaking news now. India has logged over 340,000 fresh COVID cases in the last 24 hours, with over 2,600 people losing their lives. The country's hospitals continue to remain overwhelmed with beds, ventilators and oxygen in short supply. The WHO has said India is a devastating reminder of the damage the virus can wreak. That's a third successive day of that dismal record, with over 1 million cases now recorded over the past 3 days in India. Those figures from the last 24 hours just out. Well, if that doesn't whet your appetite for a dip, I don't know what will. Yeah, you can find me on Twitter. I'm at Mark Lobel. From me and the team, thanks very much for watching. Goodbye.